So complaints really matter, and if there's one person here who knows this better than anyone, it's our first speaker, Professor Ron Paterson from Auckland, New Zealand. Now, a bit of a disclaimer here, Ron is my old boss. He remains a very dear friend and something of a mentor, and he's in great demand in both New Zealand and Australia and elsewhere for his expertise and skills and for carrying out various reviews and as a consultant. Now, Ron's been dealing with complaints in many forms for years now. He was New Zealand's Health and Disability Commissioner, dealing with complaints about all health and disability services across the whole of the country, and he was New Zealand's Parliamentary Ombudsman. He's also written a book about what makes a good doctor from a patient's perspective, and I'd encourage you to have a look at it if you can. He argues that as patients we need good information about doctors' competence, and I certainly agree with that. He's also made a few complaints himself. So all too often when we think about complaints, we tend to think about them as a local matter involving a dissatisfied consumer, a local provider, and it gets sorted out at that level. But while complaint resolution locally is and remains important, it's also important, I think, to start by thinking about what it means at a state, national, international level. You know, complaints can sometimes be the canary in the coal mine. So Ron's going to draw on his international work and talk to us, start our day thinking about why complaints matter. It's my great pleasure to introduce him.
Ngā mihi mahana ki a koto katoa. Warm Pacific greetings to you all. Ray, thank you for that generous introduction. It's a great honour to be here to speak at this inaugural conference of Australia's Aged Care Complaints Commissioner. I think we're in for a really good day. So I'd like to start by asking how many people in this room have made a complaint to someone other than, a family member or your next door neighbours. Put your hand up if you've made a complaint. I want you to leave your hand up if you think your complaint actually made a difference. So maybe about 50-50. Some of us think it made a difference, some of us aren't so sure, and some of us think it didn't. Well, I want to talk about some of the ways in which complaints do matter and do make a difference. And I also want to talk about why transparency in complaints is really important. So first, just a little bit of background. Well, actually, you've had some background from Ray. So probably the most important driver in my work in this area was the 10 years that I spent as Health and Disability Commissioner in New Zealand. And there's my first slide, and that's a lovely photograph of our staff and advocates having a conference in 2006. Now, there are some Aged Care Complaints Commission staff here. Can anyone spot Ray Lamb? So I will help. She's hiding there. She doesn't often hide, but she's there at the back. And the commissioner's that fellow up the tree there. So there we all are. This next slide just shows the front cover of annual reports of the 3 complaint handling organisations that I've been involved in over the last 16 years. So the big one there with the Samoan woman was our Health and Disability Commissioner report. At the top, I had 3 years as chair of the Banking Ombudsman Scheme in New Zealand, and you have financial ombudsman service here in Australia, so that's an industry scheme. And then I had 3 years as our Parliamentary Commissioner, one of 2 in New Zealand, Parliamentary Ombudsman, and that's really complaints central. You get to hear about all the complaints when you're an ombudsman. So I want to give you a little map of what I'm going to cover over the next half an hour. So I always love to find little local maps. So that's a map of Adelaide from 1906. But I'm going to just take you through these various ways in which I believe a complaint can make a difference. And I am going to start local, very local, looking at how a complaint can solve a local problem. And I want to tell you about how I managed to get the Auckland Council to replace a rubbish bin at Kawakawa Bay which is just along the road from my home. And I want to show you the result of my efforts. I took this photograph on Sunday. There it is, a splendid rubbish bin where there was no rubbish bin. But I want to just read you my complaint. Even I was amused when I went back and read this, and I'm not a frequent complainer. But in March 2011, I wrote to our local council. Let me read it to you. Dear Council, in February, I notified you that the rubbish bin at Raukura Point on Kawakawa Bay Coast Road has been removed. I explained I live at the last house before the point, and I've lived here for 16 years. I noted that the point is very popular for fishermen who like to leave their smelly bait bags. People are dropping litter, including smelly bait bags, in the grass around the parking area. I've been collecting the litter, but a new bin needs to be installed. It's now 6 weeks since my original inquiry. There's still no rubbish bin. People are still dropping litter. When can I expect some action? So that was actually the second complaint. So guess what happened? I got an email back with a new complaint number. And so this is what I wrote. And I'm a very patient fellow, but I wrote the following. I don't want a third service number. There aren't 3 jobs, just 1. A council contractor needs to go to Raukura Point and replace the bin. That's right, 1 bin. Then I can stop wasting your time and council staff can stop doing pointless paperwork. I'm copying this email to our local community board member, who I know will follow up. Please get the bin installed. And within a week, the bin was installed. So a funny little story, but I think from time to time we all do that to get a very local problem solved. And that is one important use of complaints. So let me take you back to our map. I now want to talk about a situation where a complaint can be very important in helping a family, helping complainants get answers to questions they might have about what's happened, why there's been a problem, and also very important in improving services for a community. And that's a really key factor, because research shows that the majority of people make a complaint because they want to stop the same thing happening to somebody else. We see that time and time again in the letters that we receive. So I want to tell you about a Samoan family from Wellington who complained to me as Health and Disability Commissioner in 2000 and 2007. And this was the headline when the case, my investigation, was reported the following year. But don't try and read the print because you can't. Just listen to the following story. So a 64-year-old Samoan man goes to Wellington Hospital Emergency Department. He's got very bad stomach pains and he's admitted for a possible bowel obstruction. And while he's in the emergency department, they take an X-ray, and the X-ray happens to show what they call an incidental finding, a shadow on his lung. So he's admitted onto a ward, and they sort out the tummy problem, and he's sent home on the Monday. It was a weekend admission. But they formally do another read on the X-ray, and a month later they report that there is a shadow on the lung that is suspicious of cancer. And that goes into a big black hole. It's never sent to the man or his family. It doesn't go to the GP. So roll forward 3 years, and the man comes back to Wellington Hospital, very ill with pneumonia, and they are going through the records. They take a fresh X-ray. They find out that he's got inoperable lung cancer, which maybe they could have operated on 3 years earlier, and they discover the failing to report the earlier X-ray. So they made a complaint to the Health and Disability Commissioner. Unusually in this case, I actually went and met with the family, the whole family, then I met with the hospital CEO. And what came out of that complaint was that the hospital agreed to help the family make their complaint, to our no-fault accident compensation scheme. And they paid for a bathroom in the home because it was a large Samoan family and having some privacy for Dad was important. They paid for that, and they also put one person to be the designated liaison person for any questions with the hospital because he was going into palliative care. And he died a year later. In the meantime, I went on and investigated what happened and discovered there was a terrible problem with a backlog in radiology reporting at Wellington Hospital. They weren't getting onto their reports for months, and others went into a black hole. And the hospital, as a result of the investigation, they made changes to improve their radiology reporting. So there you have an example of a complaint that gave answers and help to a family, but also helped a community get an improved service in Wellington. One of the really lovely things when I stood down as commissioner, this family came to my farewell at Parliament, and the daughters presented me with a beautiful piece of Samoan artwork which actually hangs at our home at Kawakawa Bay. And they still write to me every Christmas with a card. So a second example of how complaints can matter. Okay, back to our roadmap. Obviously, a complaint can be really important to highlight a problem. Now, I promise you, I'm not a regular complainer, but I did make a second complaint in 2015, and it got a lot of publicity in New Zealand. I made it as a private citizen. I made it, Ron Paterson from Auckland. But it was actually about my friend and Ray Lamb's friend, Judy Strid, and it concerned the poor care and communication that patients dying of cancer were receiving in the Auckland area, and I suspect nationally. And the reason I made the complaint was because I had promised Judy that I would do this. Judy died in the February of 2015. Let me show you a photograph of her. Here she is photographed with a much-loved fox terrier, Russell. Judy was New Zealand's Director of Advocacy. She was a prominent national figure in charge of advocacy services, but she didn't want to make a fuss and make a complaint herself, which was a great pity and very hard for her friends and family. But she made me promise to make the complaint after she died. She left me with a 60,000-word diary about all the things that she had experienced. And so I was able to use Judy's experience to complain to Auckland Hospital about cancer services. And they are making improvements, much needed improvements. So, an example of using a complaint to highlight a problem that needed attention. Rightio, let's go back to our map. Protecting the public. Sometimes it takes a complaint before action is taken to protect the public from criminal behaviour. And we saw that in Australia just last year. And I want to tell you about Tom Monagle's complaint. There's Tom. Tom's a law student in Melbourne. When he was 19 years old, he told his story in the newspaper, the story of his complaint. But this is what happened to him. He had a tic, and so a neurological problem, and he'd gone to a child, pediatric neurologist, and now as a young man, he was being referred to an adult neurologist in the Melbourne area. And he saw the neurologist twice, and he was subjected to an improper examination. He was required to strip off and touched in a way that he thought was inappropriate, and he made a complaint to the health authorities. And as a result, the health authorities said that the neurologist could only continue in practice if a patient chaperone, an independent person, was there to keep an eye on him. But while that situation was carrying on, the doctor was still seeing patients, another patient came forward with a complaint. And he said, well, there was a chaperone there, but the doctor pulled the curtain and then he touched me improperly. And so when that complaint was made, this time the doctor was suspended, The police charged the doctor with indecent assault, and sadly, the doctor committed suicide. Then Tom, who'd made the complaint, told his story to the Melbourne Age, and it was a front page story in early August last year. The minister called for an inquiry, and the Medical Board of Australia called me and said, would I come over and undertake an inquiry? And I spent the whole summer, I wrote a 55,000 word report on the topic, looking at what happens here and overseas. And as a result of that, Australia, the Medical Board, has decided as a matter of policy that patient chaperones will not be used in the future because they are an ineffective mechanism to protect patients. So that's an example of how this man's complaint has actually led to better protection of the public. And I commend Tom for his courage in doing that. Back to our map. Well, this is a big claim. Sometimes complaints can even be important to uphold democracy. I want to tell you about a complaint that a mountain climber made to me when I was New Zealand Parliamentary Ombudsman. His name was Chaz Tanner from Dunedin in the South Island, and his complaint concerned the limits on the number of guided walkers, people who pay to have a private company guide them on the Routeburn track. So there's a lovely photograph of high up on the Routeburn track, looking out towards Fiordland. And Chaz Tanner's complaint was as follows. He was a member of the Otago Conservation Board, and under our law in New Zealand, every 10 years they have to review a national park plan. So Mount Aspiring, the national park plan, was up for review, and Chaz and people from the Conservation Board, they had a big community consultation. They spent a lot of time working on it, and they decided that the limit should be kept to 24 guided walkers coming on the track every day. So, most Kiwis walk without guides, and there's a lot of what are called freedom walkers. But there's also an important place for guided walkers, but there was a limit. And they said the limit's been 24 for 10 years, and it should stay 24. The ink was barely dry on the plan, the new plan that had been approved by the Department of Conservation. It was barely dry before the company applied for an increase, and the Department of Conservation turned around and said, these are exceptional circumstances, you can have an increase to 40, an increase from 24 to 40. Now, you might look at the great outdoors in New Zealand and think, well, there's a lot of free space there, what do another 16 people matter? But actually, this was an issue about public participation in a democratic process and about the rule of law. And I said that the department's decision, I actually called it nonsense on stilts, their reasoning. I said that it was totally unreasonable for the department to make a decision that flew in the face of the limits of the new Mount Aspiring plan. So here we had a small complaint that led to a ruling that upheld democracy and the rule of law. Complaints making a difference. Complaints can also, of course, be important to prevent problems. I'm involved in some research with Dr. Marie Bismarck at the University of Melbourne, and don't worry too much about that, about the graph, but what they've done at the University of Melbourne is look at 10 years of complaints about doctors in Australia. And what they discovered is that 3% of doctors, what we discovered was 3% of doctors account for 49% of the complaints. But the other really interesting thing is, by the time you get a third complaint, you're 57% more likely than other doctors to get another complaint. So if you have that knowledge, you can start to say, well, what are the factors? Male, 35 to 55, working in plastics or obstetrics and gynecology. And now a score has been developed, a so-called prone score, showing the risk of becoming, being a frequent flyer, a complaint-prone doctor. And that's important because those doctors can then be targeted for early interventions, for remedial interventions to try and prevent problems. So as we learn more from complaints, we can use them to predict, perhaps, and certainly to try remedial interventions to prevent problems. Okay, so back to our little roadmap here. My last point is that complaints matter because they can enable consumer choice. How so? Because publication of comparative complaint rate data, information about how many complaints are being made by different sorts of providers, that can be something that informs consumers. In most private schemes, these sorts of so-called league tables are commonplace. Private industry understands that consumers need information, and actually competition in the marketplace demands transparency. Each year in its annual report, the New Zealand Banking Ombudsman actually publishes the number of complaints that have been received against all the different banks. So here's the page from the annual report, far too much information for you to read. But interestingly, in this column, they say, what's the percentage of total assets that this bank has? So we've got a bank called Kiwi Bank, and they're only 4% in terms of the size, the assets of the bank, compared with the big banks like Westpac. But although they're only 4%, they've got 12% of all the complaints that came to the Ombudsman scheme. So that's a little bit unusual. They're perhaps getting more than their fair share. So this sort of information can be very informative, and of course the banks themselves take it very seriously because they don't want to appear as if they're a frequent flyer. In the United Kingdom, the Parliamentary and Health Service Ombudsman publishes each year in the annual report, they're separate, they do a report on acute National Health Service trusts and how they compare when it comes to complaints. And as New Zealand Ombudsman, we have the FOI, Freedom of Information jurisdiction. And so in one of my rulings, I said that our Health Commissioner, the job that I used to hold, was required to publish the information that they'd been gathering about numbers of complaints by district health boards. So what used to happen is each district health board, and we have 22, were told, you're number 4 on the chart in terms of how many you get, or you're number 16. But the other district health boards didn't know, where everybody else was sitting, and the public didn't know anything. So a journalist applied under our FOI laws, and I said they're required to publish the information. I think the public in Australia and in many countries around the world has an appetite for this sort of information. I think it's healthy. I think it can drive improvements in services. And so I strongly endorse Commissioner Lamb's call for providers themselves to start making this information public. I don't think I'd call it what the Sydney Morning Herald did yesterday, which was airing your dirty laundry in public. It's not dirty laundry. There's nothing wrong with getting complaints. What matters is what you do with them. So let me conclude. John Milton said it all a long time ago. Some of you will have seen this quote, others may not. But this is back in 1644. He said, where complaints are freely heard, deeply considered, and speedily reformed, and that's a challenge to providers to get on and sort out complaints, and it's a challenge to organisations like the Aged Care Complaints Commissioner to keep on top of the in-tray. When they are speedily reformed, this is the utmost bound of civil liberty that wise men look for. I look forward to our debate during the rest of the day about how we can learn from complaints. I want to leave you with this image. I thought it was just a nice sunset on Sunday night, but it turns out it was the Aurora Australis, which was a big deal at home apparently. But this is the sunset from our from our home at Kawakaw Bay, just along the road from the rubbish bin. Thank you.